Question 1. Pharmacology. A patient with chronic heart failure, CHF, has been prescribed digoxin. As an LVN, you are responsible for administering the medication and monitoring the patient's response. Before administering digoxin, which action should you take first? A. Administer the medication with a full glass of water to prevent dehydration. B. Check the patient's apical pulse for 1 full minute and hold the medication if the pulse is below 60 bpm. C. Instruct the patient to increase potassium intake to prevent side effects of digoxin. D. Assess the patient's blood glucose levels to ensure stability before administration. Answer B. Check the patient's apical pulse for 1 full minute and hold the medication if the pulse is below 60 bpm. Explanation. Digoxin is a cardiac glycoside used to increase myocardial contractility in patients with heart failure and atrial fibrillation. However, it has a narrow therapeutic index and can cause bradycardia at slow heart rate, according to the American Heart Association, AHA, and pharmacology guidelines. LVA must check the patient's apical pulse for 1 full minute before administration. If the pulse is below 60 beats per minute, the medication should be held and the physician should be notified. Option quiz incorrect. While taking digoxin with water is good practice, it does not address the risk of bradycardia. Option C incorrect. Although low potassium levels increase digoxin toxicity risk, instructing the patient to increase potassium intake without medical advice is inappropriate. Option D incorrect. Digoxin does not directly impact blood glucose levels, making this action irrelevant. Relevant guidelines. The Joint Commission National Patient Safety Goals emphasize safe medication administration practices. The Institute for Safe Medication Practices classifies digoxin as a high alert medication requiring careful monitoring. The American College of Cardiology recommends checking renal function and potassium to reduce digoxin toxicity risks. Question 2. Medical surgical nursing scenario-based. Mr. Hernandez, a 67-year-old patient, has been admitted to the hospital for worsening chronic obstructive pulmonary disease, COPD. Upon assessment, he noticed that he is using accessory muscles to breathe, has a respiratory rate of 30 breaths per minute, and his oxygen saturation is 88% en room. His wife expresses concern about his shortness of breath and asks if he receive more oxygen. What is the most appropriate action for the LVN to take? A. Increase the oxygen flow rate to 6 Lmin via nasal cannula to improve his oxygen saturation. B. Encourage pursed lip breathing and place the patient in a high Fowler's position to promote lung expansion. C. Immediately administer bronchodilator medication without physician's order. D. Initiate back mask ventilation as the patient is in severe respiratory distress. Answer B. Encourage pursed lip breathing and place the patient in a high Fowler's position to promote lung expansion. Explanation. Patients with COPD rely on hypoxic drive to stimulate breathing. Administering too much oxygen can reduce their respiratory drive and lead to respiratory failure. The best initial intervention is to position the patient upright in high Fowler's position to facilitate lung expansion and encourage pursed lip breathing, which prolong exhalation and improve gas exchange. Option incorrect. Increasing oxygen to 6 Lmin may suppress the patient's respiratory drive and cause co-retention, leading to respiratory acidosis. COPD patients often require low-flow oxygen therapy 1-2 Lmin to prevent complications. Option C incorrect. Administering bronchodilators without physician's order is beyond the LVN scope of practice and requires an assessment by the provider first. Option D incorrect. While back mask ventilation is used for severe respiratory failure, the patient is not in respiratory arrest. He is tachypneic but still breathing independently. Relevant guidelines. The Global Initiative for Chronic Obstructive Lung Disease GOLD guidelines recommend positioning and breathing techniques as first-line interventions. The American Association for Respiratory Care ARC advises against high oxygen flow rates in patients unless indicated. The National Board for Respiratory Care, (BRC), emphasizes proper oxygen titration to maintain SPO between 88–92% in COPD patients. Question 3. Ethical and legal aspects of nursing. A licensed vocational nurse, LVN, is working in a long-term care facility. A resident, Mrs. Williams, who has dementia, refuses to take her prescribed medications. The LVN is concerned about her well-being and considers crushing the pills into her food without telling her. What is the best ethical and legal action for the LVN? A. Disguise the medication in her food to ensure compliance with the physician's orders. B. Document the refusal and notify the physician and charge nurse. C. Hold the medication and attempt again later without informing the resident. D. Physically restrain the patient and administer the medication forcibly to prevent harm. Answer: B. Document the refusal and notify the physician and charge nurse. Explanation: under patient autonomy and informed consent laws, a patient has the right to refuse treatment, including medication, even if it is detrimental to their health. Crushing medication without informing the patient, option A, constitutes medication deception, which is unethical and legally considered patient abuse. The LVET must document the refusal, notify the charge nurse and physician, and follow facility policy regarding medication refusal. Option quiz incorrect. This violates ethical nursing principles and could result in disciplinary action under the Nurse Practice Act and the American Nurses Association Honor Code of Ethics. Option C incorrect. Holding the medication and trying again later without informing the patient does not address the ethical issue of informed consent. Option D incorrect. Restraining a patient to force medication administration is a violation of patient rights and can be considered battery or assault under legal standards. Relevant guidelines. The Health Insurance Portability and Accountability Act (HIPAA) protects patient rights, including the right to refuse treatment. The Honor Code of Ethics, Provision 1, states that nurses must respect patient choices. The Centers for Medicare and Medicaid Services (CMS) prohibits coercion in medication administration and emphasizes patient dignity. Question 4. Pharmacology and medication safety. A patient with congestive heart failure (CHF) has been prescribed digoxin. As a licensed vocational nurse (LVN), you are responsible for administering the medication and monitoring the patient for potential adverse effects. Upon assessing the patient, you note that their pulse rate is 48 beats per minute. The patient also reports nausea and visual disturbances, such as seeing halos around lights. What is the most appropriate nursing action to take? A. Administer the prescribed dose of digoxin as ordered and document the patient's complaints in their medical record. B. Hold the digoxin dose, notify the healthcare provider immediately, and assess for signs of digoxin toxicity. C. Encourage the patient to drink more fluids and recheck the pulse rate in 30 minutes. D. Reduce the dosage of digoxin and administer half of the prescribed amount. Answer: B. Hold the digoxin dose, notify the healthcare provider immediately, and assess for signs of digoxin toxicity. Explanation: digoxin is a cardiac glycoside used to treat heart failure and atrial fibrillation. However, it has a narrow therapeutic index, meaning toxicity can occur easily. The pulse rate below 60 bpm, nausea, vomiting, and visual disturbances, such as yellow or green halos, are signs of toxicity. The LVN should hold the medication and notify the provider immediately. Incorrect answer A. Administering the medication without assessing for toxicity could lead to severe complications, including life-threatening arrhythmias. Incorrect answer C. While hydration is important, it does not address the underlying issue of potential digoxin toxicity. Rechecking the pulse later could delay necessary intervention. Incorrect answer D. LV do not have the authority to independently alter medication dosages. Any dosage adjustment must come from a licensed prescriber. Relevant guidelines. The American Heart Association (AHA) recommends holding digoxin if the pulse is below 60 bpm and assessing for toxicity symptoms. The Institute for Safe Medication Practices identifies digoxin as a high alert medication, meaning close monitoring is required. Question 5. Emergency and critical care nursing scenario based. Mrs. Patel, a 68-year-old woman with a history of hypertension and type 2 diabetes, is admitted to the emergency department with severe shortness of breath and confusion. Her vital signs are blood pressure 82/50 mmHg, heart rate 118 bpm, respiratory rate 30 breaths per minute, oxygen saturation 88% on room air. Upon assessment, you note that she has cool, clammy skin, weak peripheral pulses, and diminished urine output. Based on these findings, what is the most likely condition she is experiencing, and what is the priority nursing intervention? A. Hypovolemic shock. Administer fluids rapidly and elevate the patient's legs. B. Septic shock. Obtain blood cultures and administer broad-spectrum antibiotics. C. Cardiogenic shock. Administer oxygen, elevate the head of the bed, and prepare for vasopressor therapy. D. Anaphylactic shock. Administer epinephrine and prepare for emergency intubation. Answer C. Cardiogenic shock. Administer oxygen, elevate the head of the bed, and prepare for vasopressor therapy. Explanation: Mrs. Patel's symptoms, including hypotension, tachycardia, respiratory distress, and poor perfusion, suggest cardiogenic shock, which occurs due to severe heart failure or cardiac dysfunction. The priority intervention is to administer oxygen and prepare for vasopressor support to maintain adequate cardiac output. Incorrect answer A. Hypovolemic shock is caused by blood or fluid loss, e.g. from dehydration or hemorrhage, which is not the primary issue in this case. Incorrect answer B. Septic shock is caused by systemic infection and is typically associated with fever and elevated white blood cell count, which are not noted here. Incorrect answer D. Anaphylactic shock occurs due to severe allergic reaction and presence with symptoms like hives and airway obstruction, which are not present in this scenario. Relevant guidelines. The American Association of Critical Care Nurses often emphasizes the need for early recognition of cardiogenic shock to prevent organ failure. Advanced Cardiac Life Support (ACLS) guidelines recommend oxygen therapy and vasopressors, e.g. norepinephrine, dopamine, for severe hypotension. Question 6. Mental health and psychiatric nursing. A 40-year-old male patient with schizophrenia has been prescribed haloperidol Haldol for symptom management. 2 days after starting the medication, he developed severe muscle rigidity, a high fever of 103 deg, confusion, and an irregular pulse. What is the most appropriate nursing action? A. Administer the next scheduled dose of haloperidol to stabilize the patient's symptoms. B. Discontinue haloperidol immediately and notify the healthcare provider about potential medical emergency. C. Reassure the patient that the side effects will subside over time. D. Encourage increased hydration and ambulation to reduce muscle stiffness. Answer B. Discontinue haloperidol immediately and notify the healthcare provider about a potential medical emergency. Explanation. The patient is exhibiting signs of neuroleptic malignant syndrome (AMS), a life-threatening reaction to antipsychotic medications. This condition requires immediate discontinuation of the medication and emergency medical intervention, including Romanuids, cooling measures, and medications like dantrolene. Bromocriptine. Incorrect answer A. Continuing haloperidol could worsen NMS and lead to multi-organ failure. Incorrect answer C. NMS is not a mild, self-limiting reaction. It is medical emergency requiring immediate intervention. Incorrect answer D. While hydration is helpful, it does not address the underlying neuromuscular dysfunction caused by NMS. Relevant guidelines. The American Psychiatric Association (APA) states NMS is medical emergency requiring immediate discontinuation of the causative medication. The Food and Drug Administration (FDA) warns that all patients on first-generation antipsychotics should be monitored for signs of AMS. Question 7. Patient safety and falls prevention. A 75-year-old female patient with osteoporosis is admitted to the medical surgical unit following a hip fracture. The patient is alert and oriented but has poor balance and weakness when ambulating. The nurse assigns a fall risk score of 5, high risk. Which nursing intervention is the most appropriate to prevent falls? A. Keep the bed in the lowest position, ensure adequate lighting, and provide a call bell within reach. B. Restrain the patient to prevent accidental falls when the nurse is not present. C. Encourage the patient to ambulate without assistance to regain mobility. D. Place the patient near the nursing station but avoid using bed alarms to reduce distress. Answer A. Keep the bed in the lowest position, ensure adequate lighting, and provide a call bell within reach. Explanation. Keeping the bed low, providing lighting, and ensuring access to the call bell promotes patient safety while encouraging independence. Incorrect answer B. Restraints increase fall risk and should only be used as a last resort. Incorrect answer C. The patient requires assistance when ambulating due to her fall risk. Incorrect. D. Bed alarms are an important safety measure for high-risk patients. Guidelines. The Joint Commission recommends fall risk assessments and using bed alarms, call lights, and assistive devices. Question 8. Infection control and isolation precautions. A 57-year-old male patient with active tuberculosis (TB) is admitted to the hospital. What is the priority nursing action to prevent transmission? A. Place the patient in a negative pressure isolation room and ensure staff wears an N respirator. B. Assign the patient to a standard private room and use surgical masks. C. Allow visitors as long as they maintain a 3-foot distance. D. Initiate droplet precautions and require staff to wear face shields. Answer A. Place the patient in a negative pressure isolation room and ensure staff wears an own respirator. Explanation: TB is an airborne disease requiring negative pressure rooms and air respirators. Incorrect answer. B. Standard rooms are inadequate for airborne precautions. Incorrect answer. C. TB transmission risk remains high even with social distancing. Incorrect answer. D. Droplet precautions are insufficient for TB. Airborne are required. Guidelines: the Centers for Disease Control (CDC) mandates negative pressure rooms and air masks for TB patients. Question 9. Medication administration scenario-based. You are preparing to administer romanoacim chloride (KCl) 40 mEq to a patient with hypokalemia. What is the most important safety measure? A. Dilute KCl in 100 ml of normal saline and infuse over 1 hour. B. Administer KCl at aroma shift for rapid correction of potassium levels. C. Inject KCl directly into the roman without dilution. D. Administer KCl intramuscularly to prevent vein irritation. Answer A. Dilute KCl in 100 ml of normal saline and infuse over 1 hour. Explanation: romanopotassium must always be diluted and never given as a bolus to prevent cardiac arrest. Incorrect answer. B and C. Romano KCl can cause fatal arrhythmias. Incorrect answer. D. Potassium is contraindicated due to severe tissue damage risks. Guidelines: the Institute for Safe Medication Practices is dilute romanopotassium as high risk. Question 10. Delegation and scope of practice. An LVN is working with a nursing assistant (CNA), which task is appropriate to delegate to the CNA? Administering a subcutaneous insulin injection. B. Performing a sterile wound dressing change. C. Monitoring a patient's response to pain medication. D. Assisting a patient with ambulation. Answer D. Assisting a patient with ambulation. Explanation: CNAS can assist with ambulation, bathing, and repositioning. Incorrect answer. C. CNAS cannot administer medication, perform sterile procedures, or assess medication effects. Guidelines: the National Council of State Boards of Nursing (SEN) outlines delegation guidelines for CNAS. Question 11. Diabetes management. A diabetic patient with a blood glucose of 5 mg/dL is confused and diaphoretic. What is the priority intervention? A. Administer romano insulin. B. Give 15 grams of fast-acting carbohydrates, such as fruit juice. C. Perform a second blood sugar test in 30 minutes. D. Encourage increased fluid intake. Answer B. Give 15 grams of fast-acting carbohydrates, such as fruit juice. Explanation: hypoglycemia Dg7-MDEL requires immediate glucose intake. Incorrect answer. A. Romano insulin would worsen hypoglycemia. Incorrect answer. C. D. Delaying treatment increases risk of seizures or coma. Guidelines: the American Diabetes Association (ADA) recommends the rule of 15 for hypoglycemia. Question 12. Prioritization in emergency situations. A patient in the emergency room is experiencing anaphylaxis after receiving an antibiotic. What is the first-line treatment? A. Administer epinephrine, EpiPen. B. Provide romanoids first. C. Give antihistamines, Benadryl. D. Perform a chest X-ray. Answer A. Administer epinephrine, EpiPen. Explanation: epinephrine is life-saving in anaphylaxis. Incorrect answer. B. D. Antihistamines and romanoids alone are not enough. Guidelines: the World Allergy Organization states that epinephrine is the gold standard for anaphylaxis. Question 13. Fluid and electrolyte imbalances. A patient with chronic kidney disease has a potassium level of 6.8 mecq. What is the priority nursing intervention? A. Encourage potassium-rich foods. B. Prepare for emergency dialysis. C. Administer only potassium. D. Monitor the patient every 6 hours. Answer B. Prepare for emergency dialysis. Explanation: severe hypokalemia 6.5 mecq requires immediate treatment to prevent fatal arrhythmias. Incorrect answer. A. C. D. Further increasing potassium or delaying treatment can be fatal. Guidelines: the American Kidney Foundation recommends dialysis for life-threatening hypokalemia. Question 14. Respiratory emergencies. A 65-year-old patient with a history of COPD is admitted with shortness of breath and low oxygen saturation, SPOLS 85%. The nurse applies 12 nasal cannula oxygen. The patient's respiratory rate decreases from 22 to 10 breaths per minute. What is the priority action? Increase oxygen to form and to improve oxygenation. B. Continue monitoring the patient and reassess in 30 minutes. C. Reduce oxygen to 1 min and prepare for possible ventilation. D. Encourage deep breathing and coughing. Answer C. Reduce oxygen to 1 min and prepare for possible ventilation. Explanation. High oxygen levels can suppress the respiratory drive in COPD patients, leading to hypoventilation and respiratory failure. Incorrect answer A. Increasing oxygen worsens co-retention in COPD. Incorrect answer B. Delayed intervention increases risk of respiratory failure. Incorrect answer D. While helpful, deep breathing alone will not cure oxygen-induced hypoventilation. Guidelines. The American Lung Association advises low-flow oxygen therapy 1. Toulmin for COPD. Question 15. Pressure ulcer prevention. A bedridden patient with limited mobility is at high risk for pressure ulcers. What is the best nursing intervention to prevent skin breakdown? A. Reposition the patient every 2 hours and use pressure-relieving devices. B. Massage the patient's reddened areas to improve circulation. C. Encourage increased fluid intake to keep the skin hydrated. D. Apply an occlusive dressing to all bony prominences. Answer A. Reposition the patient every 2 hours and use pressure-relieving devices. Explanation. Frequent repositioning and pressure relief devices prevent ulcers. Incorrect answer B. Massaging red areas can worsen skin damage. Incorrect answer C. Hydration helps but does not replace pressure relief. Incorrect answer D. Occlusive dressings trap moisture and increase skin breakdown risk. Guidelines. The National Pressure Injury Advisory Panel recommends repositioning every 2 hours. Question 16. Delegation in nursing. A is working with a nursing assistant, CNA, which task can be safely delegated. A. Performing a sterile wound dressing change. B. Checking the patient's blood glucose level. C. Administering oral medications. D. Assessing patient's pain level. Answer B. Checking the patient's blood glucose level. Explanation. CNAS can perform non-invasive tasks like checking vital signs and glucose levels. Incorrect answer. And C. Sterile procedures and medication administration require LVRN involvement. Incorrect answer. D. Pain assessment requires critical thinking, which CNAS are not licensed to perform. Guidelines. The National Council of State Boards of Nursing (ISI) outlines delegation rules for CNAS. Question 17. Romanotherapy safety. A patient receiving romanotherapy suddenly develops difficulty breathing, chest tightness, and hypotension. What is the nurse's priority action? A. Slow down the romanotherapy and notify the physician. B. Stop the aroma effusion and administer oxygen. C. Check the patient's blood glucose level. D. Elevate the patient's legs to improve circulation. Answer B. Stop the aroma infusion and administer oxygen. Explanation. These symptoms indicate anaphylaxis or fluid overload requiring immediate aroma discontinuation and oxygen therapy. Incorrect answer A. Delaying intervention can lead to shock or cardiac arrest. Incorrect answer C and D. Blood glucose and leg elevation do not address the immediate respiratory emergency. Guidelines. The American Heart Association recommends stopping romanotherapy immediately if a reaction occurs. Question 18. Postoperative care. A postoperative patient is experiencing nausea and vomiting after surgery. What is the nurse's best intervention? A. Encourage the patient to drink clear fluids immediately. B. Position the patient in side-lying position to prevent aspiration. C. Increase aroman fluid rate to flush out anesthesia. D. Have the patient lie flat to rest. Answer B. Position the patient in a side-lying position to prevent aspiration. Explanation. Side-lying positioning prevents aspiration of vomitus. Incorrect answer A. Oral fluids are not appropriate if nausea persists. Incorrect answer C. Roman fluids do not directly treat nausea. Incorrect answer D. Lying flat increases aspiration risk. Guidelines. Postoperative nursing protocols recommend side-lying positioning for nausea prevention. Question 19. Cardiac arrest management. A patient is unresponsive, pulseless, and not breathing. What is the first action the nurse should take? A. Start chest compressions immediately. B. Administer epinephrine. C. Check the patient's blood pressure. D. Give the patient oxygen via nasal cannula. Answer A. Start chest compressions immediately. Explanation. High-quality CPR should be initiated immediately for cardiac arrest. Incorrect answer. BD, Rome medications, and oxygen as secondary interventions. Guidelines. The American Heart Association, AHA, emphasizes compressions, airway breathing into. Question 20. Pain management in the elderly. An elderly patient with arthritis refuses pain medication, stating, I don't want to get addicted. What is the best nursing response? A. You should take your pain medication before the pain gets worse. B. Addiction is rare when medications are taken as prescribed. C. You will eventually get used to the pain. D. Try taking half of the prescribed dose instead. Answer B. Addiction is rare when medications are taken as prescribed. Explanation. Educating patients about low addiction risks helps improve pain management adherence. Incorrect answer. And C. These responses dismiss patient concerns. Incorrect answer. D. Altering prescribed doses is unsafe. Guidelines. The CDC and WHO Pain Management Guidelines recommend patient education on opioid use. Question 21. Diabetes foot care. A diabetic patient asks for advice on foot care. What should the nurse include? A. Walk barefoot at home to strengthen your feet. B. Trim your toenails straight across to prevent injury. C. Use hot water soaks to improve circulation. D. Apply lotion between your toes to prevent dryness. Answer B. Trim your toenails straight across to prevent injury. Explanation. Straight nail trimming prevents ingrown nails and infections. Incorrect answer A. C. D. Walking barefoot and excessive moisture increase infection risks. Guidelines. The American Diabetes Association (ADA) recommends proper foot hygiene to prevent diabetic ulcers. Question 22. Seizure precautions. A patient with epilepsy suddenly experiences a generalized tonic-clonic seizure while lying in bed. What is the nurse's priority action? A. Restrain the patient's arms and legs to prevent injury. B. Place padded tongue blade in the patient's mouth. C. Turn the patient to the side lying position and protect their airway. D. Hold the patient in sitting position to prevent aspiration. Answer C. Turn the patient to the side lying position and protect their airway. Explanation. Turning the patient to their side prevents airway obstruction and aspiration. Incorrect answer. And B. Restraint and placing objects in the mouth can cause injury. Incorrect answer. D. Sitting up is unsafe during a seizure. Guidelines. The Epilepsy Foundation recommends side-lying positioning and airway protection during seizures. Question 23. Fluid volume overload. A patient receiving Romanuids at 125 mHR suddenly develops crackles in the lungs, edema, and dyspnea. What is the best nursing action? A. Slow omno rate and notify the provider. B. Administer an additional 500 Romanuids. E. Place the patient in a Trendelenburg position. D. Encourage the patient to drink more fluids. Correct answer A. Slow Romano rate and notify the provider. Explanation. Signs of fluid overload require slowing the aromatase effusion. Incorrect answer B. C. D. More fluids or incorrect positioning can worsen symptoms. Guidelines. The CDC and Joint Commission recommend monitoring fluid balance closely. Question 24. Postoperative urinary retention. A male patient who had abdominal surgery 6 hours ago reports bladder discomfort and an inability to urinate. What should the nurse do first? A. Perform a bladder scan to assess urine retention. B. Administer a diuretic to promote urination. C. Encourage the patient to drink more fluids. D. Call the provider for a catheterization order. Answer A. Perform a bladder scan to assess urine retention. Explanation. A bladder scan helps determine retention before intervention. Incorrect answer B. C. D. Diuretics, fluids, or a catheter without assessment may not be appropriate. Guidelines. Postoperative nursing protocols recommend bladder scans for retention assessment. Question 25. Wound care for a diabetic patient. A patient with diabetes has a foot ulcer with purulent drainage. What is the nurse's priority intervention? A. Instruct the patient to soak the foot in warm water. B. Apply an occlusive dressing and monitor for improvement. C. Assess for signs of infection and notify the provider. D. Encourage the patient to wear tight-fitting shoes for support. Answer C. Assess for signs of infection and notify the provider. Explanation. Diabetic foot ulcers can lead to severe infections, requiring immediate assessment. Incorrect answer A. B. D. Soaking wounds, occlusive dressings, or tight shoes can worsen infections. Guidelines. The American Diabetes Association (ADA) recommends early intervention for foot infections. Question 26. Tuberculosis (TB) isolation precautions. A patient with active TB is admitted to the hospital. What infection control measures should the nurse implement? A. Place the patient in a negative pressure room with airborne precautions. B. Use only standard precautions since TB is not highly contagious. C. Wear only gloves and a surgical mask when entering the room. D. Keep the patient's door open to improve ventilation. Answer A. Place the patient in a negative pressure room with airborne precautions. Explanation: TB requires airborne precautions and a negative pressure room. Incorrect answer B. C. D. TB is highly contagious and requires in masks and isolation. Guidelines: CDC guidelines require airborne precautions for active TB cases. Question 27. Hypoglycemia management. A diabetic patient is found confused and diaphoretic. Their blood sugar is 45 mg/dL. What is the nurse's priority action? They administer 15 grams of fast-acting carbohydrates. G. Orange juice. B. Give the patient an insulin injection. C. Call the provider before intervening. D. Encourage the patient to lie down and rest. Answer A. Administer 15 grams of fast-acting carbohydrates. G. Orange juice. Explanation: hypoglycemia treatment includes quick glucose sources. Incorrect answer B. C. D. Insulin worsens hypoglycemia and delaying treatment can be dangerous. Guidelines: the American Diabetes Association (ADA) recommends the 1-5-1-5 rule for hypoglycemia. Question 20. Chest pain emergency. A patient experiencing chest pain rates at 8-10 and appears pale and diaphoretic. What is the nurse's first action? A. Administer sublingual nitroglycerin. B. Ask the patient to rate their pain again after 10 minutes. C. Perform full neurological assessment. D. Give the patient glass of water to drink. Answer A. Administer sublingual nitroglycerin. Explanation: nitroglycerin is the priority intervention for chest pain. Incorrect answer B. C. D. Delaying treatment can worsen myocardial infarction. Guidelines: the American Heart Association (AHA) recommends nitroglycerin for angina. Question 29. Stroke assessment fast test. A patient suddenly develops slurred speech and facial drooping. What is the nurse's priority action? A. Perform neurological assessment and call for help. B. Give the patient oral fluids to keep them hydrated. C. Ask the patient to stand up and walk. D. Wait 30 minutes to see if symptoms improve. Answer A. Perform a neurological assessment and call for help. Explanation: neurological deficits require urgent intervention for stroke. Incorrect answer B. C. D. Delaying assessment worsens stroke outcomes. Guidelines: the American Stroke Association (ASAP) recommends immediate stroke assessment fast test. Question 30. Postpartum hemorrhage management. A postpartum patient is experiencing heavy vaginal bleeding, saturating a pad in 15 minutes. What is the nurse's priority action? They massage the fundus of the uterus to promote contraction. B. Encourage the patient to ambulate to reduce bleeding. C. Offer the patient oral fluids to increase blood volume. D. Call the provider without taking further action. Answer A. Massage the fundus of the uterus to promote contraction. Explanation: uterine massage stimulates contraction, reducing postpartum bleeding. Incorrect answer B. C. D. Ambulation fluids or waiting can delay emergency intervention. Guidelines: the American College of Obstetricians and Gynecologists (ACOG) recommends fundal massage for postpartum hemorrhage.